Welcome to listen to a presentation about the physiological background of the lifestyle assessment method. How we get from heart rate and heart rate variability to stress and recovery. The heart has to constantly react to various needs of life, to changing situations, and it does this via the autonomic nervous system and other physiological regulation systems. Heart rate variability means the variation in time between consecutive heartbeats, and it contains a lot of information about the body's physiology. Basically, we look at heart rate variability as a window into the body, what's happening inside. Heart rate variability is closely regulated by the body and what the body does. At rest and during relaxation, heart rate variability increases, whereas during some kind of stress, heart rate variability typically decreases. Many factors affect heart rate variability, such as age, physical fitness, health status, and different stressors, and we will be having a closer look at those during this presentation. In general, one can say that high heart rate variability is considered a sign of good health and a healthy heart, whereas low values can indicate internal or external stress or some kind of weak recovery. A little bit of the terminology in the back of the method. So heart rate value means the average heartbeat frequency as beats per minute, the very familiar value to also end clients, the value that they know that was taken at the doctor's office or what their heart rate monitor that they're using is showing. Heartbeat means the RR interval or the time between consecutive heartbeats, R waves in milliseconds. So we identify the R wave from the heart's electrical graph and measure the time between beats. And heart rate variability means the beat-to-beat variation in the time between consecutive RR intervals. How much this time between beats varies from one beat to the next. Heart rate variability provides a lot more accurate and deep information about the body than just looking at average heart rate values. The Bodyguard 2 device records every heartbeat and the time between beats in milliseconds. And it does this as a very high accuracy, with a frequency of 100 Hz, meaning that Bodyguard is an accurate professional grade device that can be reliably find every heartbeat and the time between beats and allows very high grade heart rate variability analysis. We upload the information from the Bodyguard into the lifestyle assessment program, and then the analysis program analyzes or estimates the following variables based on heart rate variability. We can estimate respiration frequency with a high accuracy, oxygen uptake, energy expenditure, training effect, and recovery and stress. And these physiological indexes are important, have an important role in the algorithms that we use to go from the heartbeat information into the actual analysis of stress and recovery and the reports that the client gets. So this figure sort of shows the process. The Bodyguard is plugged into the computer. The data is uploaded from it. It's an output file that looks like this, just millisecond values between heartbeats, so it doesn't contain any more information than just this. And then that information is analyzed, and that's where we utilize these other physiological indexes to then eventually arrive at the report that's understandable to the end client. Basically, heart rate and heart rate variability have an inverse relationship. So when the heart rate drops, heart rate variability increases, and when heart rate climbs, heart rate variability decreases. Heart rate variability thus increases during rest and relaxation when heart rate is low, and typically decreases when there is some kind of load, for example, stress or physical activity. And this figure here exemplifies that a little bit. The lower graph is the RMSSD graph. That's an index of heart rate variability, describes parasympathetic activation. The higher values of RMSSD mean better recovery or higher parasympathetic activation. Here you can see some kind of a stress situation. The heart rate increases. The red bars increase, meaning that the stress reaction is stronger, and at the same time heart rate variability sharply drops. So stress reaction causes a drop in heart rate variability. Same with physical stress. During exercise, heart rate increases significantly. The blue color indicates that, and then heart rate variability is going to be very low during that time. Very natural reaction to physical activity is a strong stressor, and thus the heart rate variability will be very low during that. But then during sleep, this is what we would expect to happen. The heart rate level drops gradually during the sleep period, and the green bars indicate that recovery is occurring. The green bars getting higher towards the last part of the night. You can see that when the heart rate gets lower, the green bars get higher, and at the same time heart rate variability values are increasing. This is normally what we see happening. It's not always the case, and I'll show a few examples when this is not happening, but this is the basis of the analysis what we use in determining these different states. So any kind of load or a particular overload has a clear effect on heart rate variability. These stressors can be things like stress, lack of sleep, illnesses, drugs and alcohol, poor physical condition, and overweight. They all stress the body and also reduce heart rate variability. And physical training that's too hard and too intensive, that takes on for a long time, can also lead to overtraining and reduced heart rate variability. And that's what this example here is going to be discussing. It's an example of an athlete's overtraining state. The top graph here that you can see, it's a 5-minute resting test. The athlete was laying down and breathing normally. Their average heart rate was 48 beats per minute, average heart rate variability 82 milliseconds, meaning the variation between beats. The graph is going up and down in a seesaw pattern. That's a sign of a strong heart rate variability, indicates good recovery and a good health status. Then 2 months later, when the athlete had been training very hard, very intensively with a progressively increasing load, the same test was repeated, 5-minute resting test. The average heart rate value is just about the same, actually 1 beat lower. But as you can see, now there is no more up and down pattern in the graph. Instead, it looks almost like a straight line, and the average heart rate variability is only 12 milliseconds, which is a very low, almost pathological value for a young, healthy athlete. Heart rate variability very low, obvious sign of some kind of overload or imbalance, no sign of recovery. And clearly for an athlete, this kind of result would immediately mean that some kind of action needs to be taken, training needs to be significantly altered, rest needs to take place so that the athlete could bounce back from that. And the same basic response happens in a normal person who works too hard, has too much going on in life and doesn't take time to recover. And that's of course in the background of the whole lifestyle assessment method, trying to identify these kind of situations. This slide shows some of the patterns of heart rate variability during the day and night. Normally heart rate variability is greater during sleep than during the day, but short and long-term stressors such as alcohol, medications, illnesses, stressors can mix up the normal autonomic regulation pattern. The top example here is basically a young, healthy, normal graph, normal person. You can see that the average heart rate variability during the daytime, 69 milliseconds, during sleep, 118 milliseconds. So very strong variation during night when the person is sleeping, meaning that the parasympathetic system is functioning like it should. The relative difference between the daytime and the nighttime is 1.7, and in our scale that we have in this report, if it's 1.5 or more, it's considered a good difference, that the nighttime values are 50% higher than during the daytime. If it's between 1 and 1.5, it's considered a moderate result. And if it's under 1, meaning that the heart rate variability is lower during sleep than during the day, then it's considered a weak result. The second example here shows that the heart rate variability graph is pretty much the same during the day and night. No significant change during the sleep period. It starts to increase a little bit towards the latter part of the night, but the relative difference being 1.1. In this case, the explanation is probably some kind of acute stress. The person was experiencing a lot of back pain over these days and had also had a couple of units alcohol, and both pain and alcohol tend to reduce heart rate variability and offset the autonomic balance. Most likely an acute situation that is quickly corrected though. And then the bottom example shows an example of where heart rate variability graph basically goes backwards how we would expect. The values are actually dropping while the person is sleeping and higher during the daytime. The relative difference 0.6. Obviously, this is not how we would expect the autonomic regulation to work. Something is mixing up the autonomic balance here. It could be in this case because the person has a lot of different chronic illnesses and a lot of different medications. Both illnesses and medications are known to affect heart rate variability and can affect that particularly while we are resting, sort of blocking the parasympathetic activation from kicking in. And it's not very typical to see a graph like this, but it's also not all that uncommon. And the main thing is to be aware of something like this. It's possible for the graph to behave like this, for heart rate variability to behave like this, and then try to understand why is that happening. Is it some kind of a stress situation that we can start affecting, a chronic load, or if it's more related to the person's basic health status. These graphs here, these RMSSD graphs, are available in the specialist report. It's not designed for the client, but you can access them when you're creating reports. You can make the specialist report and go deeper into the understanding of the client's result by looking to see how this graph behaves. This slide shows emphasizes some of the important factors that affect heart rate variability, and I would like to emphasize the role of the yellow chart here, the heritance or genetics part. It's about 1/3 of your heart rate variability level is affected by genetics alone, and obviously we can't affect that. And this is important to keep in mind, and we also take that into consideration in the analytics, that we don't put too much emphasis on just the absolute heart rate variability value, but we include other physiological indexes in our calculations to make sure that the genetics doesn't determine whether you can have a good result or a bad result. We know that stress affects heart rate variability, and that's obviously something that we can affect with lifestyle coaching and right lifestyle choices. That's something that often comes up in the discussions. Also, health and disease, the health status and diseases affect heart rate variability. Many times we can affect that with correct lifestyle choices or better lifestyle choices, at least make it better, maybe not get rid of all of that, but make better situations. And physical fitness has a very strong role in this. So if the person improves their physical fitness, their aerobic fitness in particular, they can increase their heart rate variability by doing that. And that's of course something that the lifestyle assessment should focus on, what we can affect and do about it. Age has a big role on heart rate variability. We know that when we get older, heart rate variability drops. The graph here shows what's actually from the lifestyle assessment report, and this line here under sleep section, quality of recovery, that's the actual heart rate variability value in milliseconds during the sleep period. And whether you get into the poor, moderate, or good category, the age is taking place or affecting the reference values. So for a 50-year-old versus a 20-year-old, this value, what gets you to good, is going to be significantly different. And that of course makes it more reliable for the person when the result is compared to their own age group rather than some kind of general population level average. And the graph behind here shows what this is based on. We've taken it from our database, all of the measurements that have been done, and a very clear trend shows here. When we get older, the heart rate variability value gets lower, whether it's taken during 24-hour period or during sleep. And then we have categorized the results into poor being the lowest 10% of your age group average, and good being the 50% or higher of your age group average. And that determines where you are placed on this scale under quality of recovery. Autonomic nervous system, as I mentioned before, is in the back of all of this. It affects what we do with Firstbeat lifestyle assessment, and we basically mirror what happens in the autonomic nervous system. It's divided into the sympathetic and parasympathetic sides, with sympathetic basically being the gas of the body, the fight or flight system that allows us to perform and meet challenges by speeding up bodily functions. Heart rate increases, heart rate variability decreases. It shows up as some kind of stress reaction and red color in the report, sympathetic dominance. Parasympathetic nervous system, on the other hand, calms down bodily functions, can be considered the brake of the body. Heart rate slows down, heart rate variability increases, and it shows up as some kind of recovery or green color in the report. And in lifestyle assessment, we always look to see if the autonomic nervous system functions purposefully or meaningfully. So if recovery happens when the person actually has a chance to recover, instead of focusing on how many minutes of stress there is in the day, or if there is any stress in the day, because we do consider this a normal part of life, but as long as we also get to the recovery when it's meaningful. And this slide goes a little bit deeper into these different physiological states that you will see in the Firstbeat lifestyle assessment reports. The red color meaning stress reactions, elevated activation level in the body. The reaction can be positive or negative, and it means sympathetic nervous system is dominating. Heart rate elevated, respiration frequency is elevated from the base level, heart rate variability is low, and oxygen uptake below 20% of maximal capacity. And recovery, or the green color on the other hand, meaning a calming down of the body, parasympathetic dominance, lower heart rate, lower respiration rate, increased heart rate variability, and again oxygen uptake below 20%. Then the physical activity states, blue color or light blue color, moderate, vigorous, or light physical activity. That's identified based on the fact that energy expenditure and oxygen uptake are elevated from the base level. Light physical activity, 20 to 40% of maximal performance. So low level physical activity, moderate meaning 40 to 60% of maximal capacity, and vigorous physical activity identified when the intensity is over 60% of maximal capacity. And then in addition to these red, green, and blue colors, the reports usually have some white color, which we call other state. It typically means recovery from exercise. So whenever there's an exercise session, you always see some half an hour to an hour of white color after that, when the body is naturally coming down from the exertion of the exercise. Also missing data periods, for example, during a shower, like you can see here, the heart rate graph turns into red and the device is actually off. So then there is always white other state during that. Also some kind of very low level physical activity when the person is moving about and doing some kind of activity that can be identified, but if the oxygen uptake and heart rate response is very, very low, too low to be actually considered physical activity or exercise, then sometimes we will see white color that means that it's not a traditional stress reaction, but it's not physical activity either. And then also short awakenings during the sleep period. Typically when the person is switching between different sleep cycles, there sometimes are some segments of white, and the more white there is during the sleep, usually it means that it's not fully peaceful sleep, but of course it's not as bad as if you see a lot of stress reactions during the sleep period. It's quite normal to have some other state in the reports. Somewhere between 10 and 20% is typical, but of course if there is a lot more than that, then it needs to be discussed why that is that the analysis was not able to identify these other states. Many different factors and events can cause stress and stress reaction. And obviously the key to this slide is not to memorize all the factors, but to be aware of that there is a lot of things that can cause stress. And it's important to understand what in the person's life was causing the stress reaction in the report, instead of trying to get rid of the red color in the report. So many times it can be quite a normal part of life. Heat or cold or noise in a workplace is an example of an external physical stressor that can cause a physiological stress reaction. We can't help that. Of course, and also medications and alcohol can cause that, or internal physical stressors such as infections or pain or an illness can cause that. Also burnout or long-term overload is an example of an internal stressor. Psychological stressors, negative emotions, depression, hurry, work stress can of course cause stress reactions and is often the focus of these assessments. And then different social stressors, fear of a presentation, lack of support, pressure typically can cause a physiological stress reaction. Firstbeat analysis does not differentiate between positive and negative stress reaction. This is good to keep in mind when looking at this example here. You can see, for example, in the afternoon the person is watching sports. It was Olympic event, and you can see that the red stress color is really climbing high, some kind of a strong stress reaction. It was a very exciting event, and the person was living with what was happening in the sports. Their heart rate was elevated, they were excited, it was all fun and positive, but still it causes a strong stress reaction. So instead of making that a problem, it's just good to know what you were doing that caused the reaction here. An argument in the evening, an example of a little bit more negative stress reaction. You can see the red colors rising here in the evening. It occurred right before bed and quite possibly had an effect on why there are even quite a few stress reactions persisting into the sleep period. So important in the lifestyle assessment is to sort of focus on the big picture and what was going on in the person's life, rather than the actual minutes of physical activity or stress that was seen in the report. And that's why, of course, the journal plays an important role. So the person can go back to the journal, they can see what they were doing at specific times of the day, and then what kind of reaction that caused. Positive stress is thought to activate the body and improve efficiency. We know that. And in general, it doesn't disturb our recovery or sleep. So if the stress that we have in our lives is something that we can handle, we can cope with it, we find it a positive and exciting thing, then usually our body is able to slow down and come down from it quite quickly and get good recovery, like the top graph here shows. Of course, it's a good reminder that even positive stress, if it's excessive and goes on for a long time, it still can overload the body and end up in some kind of a stress situation and overload. So even positive stress needs to be controlled, and we do need to take the downtime, the time to calm down and take it easy instead of be driving in this fight or flight mode all of the time. But then the thinking is that negative stress, when it's more pressure, hurry, the feelings that we are not too happy about, it keeps the body constantly activated or wired. And it prevents recovery even when we go to sleep or are resting. So even when we lay down to rest, nothing happens. The heart rate doesn't slow down. The heart rate variability doesn't increase. We are not able to switch from the sympathetic system to the parasympathetic system. And this example clearly shows that. The night period shows almost all red, the heart rate stays quite high. So clearly recovery is not happening at the time when it would be meaningful for that to happen. Many explanations can cause that, like we looked at before. It could be a long work day, doing a lot of work in the evening, but most likely this is a bit more chronic situation. So an individual day typically doesn't cause a reaction like this. But when it happens day after day or week after week, then a person can get to a point where their body is not slowing down even when they are resting. And obviously this is like a red flag and good time to stop and start thinking what you can do to find a better balance for the situation. So thank you very much. That was physiological background of the lifestyle assessment method in a nutshell. More information you can find in the Firstbeat white paper about stress and recovery. I really recommend reading that. It goes a little bit deeper into the calculations of how we arrive at the final result. And also our science section on our website has a lot of publications about how the method has been applied and used in different studies. So I recommend reading those. Thank you very much.